The Robert Koch Institute is a German federal government agency and research institute responsible for disease control and prevention. It is located in Berlin and Wernigerode. As an upper federal agency, it is subordinate to the Federal Ministry of Health. It was founded in 1891 and is named for its founding director, the founder of modern bacteriology and Nobel laureate Robert Koch. The Robert Koch Institute monitors public health. Its core tasks include the detection, prevention and combating of infectious diseases and non-communicable diseases in Germany. The institute advises the specialist public and government, e.g. on preventing and tackling infectious disease outbreaks such as the COVID-19 pandemic, the swine flu pandemic in 2009 and the EHECO 104 H4 outbreak in 2011. The institute is also in charge of health monitoring and health reporting in Germany, covering non-communicable diseases. In large monitoring studies, RKI monitors the health status of adults and children in Germany. RKI scientists regularly publish their results in scientific journals and in their own reports, e.g. the Infectious Disease Epidemiology Annual Report, special reports on different diseases in Germany, and the Commission for Hospital Hygiene and Infection Prevention are also based at the Robert Koch Institute. RKI staff are involved in various international research projects and programs, helping to tackle urgent public health problems such as the Ebola outbreak in West Africa in 2011. RKI also cooperates closely with international partners like the European Centre for Disease Prevention and Control and has been the WHO Collaborating Centre for Emerging Infections and Biological Threats since 2016. RKI is the only federal institute in Germany in the field of human medicine with a BSL-4 laboratory. The Robert Koch Institute has its headquarters and 2 additional sites in Berlin as well as a site in Wernigerode, Harz region. RKI's focus is on research. Some 450 of about 1,100 members of staff are scientists. The institute consists of the following units: a museum presenting the life and work of Robert Koch as well as of the institute today is located at the main building at Nordufer site and open to visitors from Monday to Friday. The mausoleum with Robert Koch's remains can also be visited. The institute was formed by the later Nobel Prize laureate Robert Koch in 1891 as the Royal Prussian Institute for Infectious Diseases. Koch lived until the age of 66, when he died of a heart attack in Baden-Baden on the 27th of May 1910. His ashes were buried in a mausoleum in his institute on the 10th of December 1910. The director from 1917 to 1933 was Fred Neufeld, who discovered the pneumococcal types. Neufeld's deputy director from 1919 to 1933 was Walter Lewandel. During the Third Reich, the institute took part in atrocities committed in the name of National Socialism, such as experiments into typhus vaccines at Buchenwald concentration camp in 1941. Resulting in the deaths of 127 of the 537 inmates involved. The institute was renamed the Robert Koch Institute in 1942. Following the collapse of the regime, only few scientists ever had to face legal consequences, and their crimes were largely ignored for the remainder of the century. In 1952, the institute became a subordinate agency of the Federal Health Agency. Following the German reunification in 1990, some former GDR health agencies were integrated in the Robert Koch Institute. One of them was the Institute for Experimental Epidemiology in Wernigerode, Harz region, which is still an RKI location today. In 1994, the Federal Health Agency was dissolved, and RKI became an independent federal agency within the portfolio of the German Federal Ministry of Health. 2 of the former Federal Health Agency institutes, the Berlin-based AIDS Center and the Institute for Social Medicine and Epidemiology, were attached to the Robert Koch Institute. The RKI, which until then was occupied with infectious diseases alone, now had a second big topic: non-communicable diseases and their risk factors. In 2020, the institute was responsible for publishing contact tracing smartphone apps as part of the German government's response to COVID-19. Since its inception in 1891, the RKI has had 15 individual presidents.